Hello, this is Henry Stanley. I am going to be performing a wound irrigation and wet to dry dressing change. Currently, this is what I'm working with for my PPE. For this procedure, we would use a gown, mask, eyewear, and gloves. Obviously, this is not my real PPE, but this is what we're working with. Some of the supplies we have is our current wound dressing. That's what the wound looks like. We have our emesis spacing in place. We have our sterile field already set up. This is what I'm using for that. With gauze that I'm going to be wetting. This is the syringe that we're going to be using to irrigate. Fortunately, we don't have that, so I use a water bottle with a hole in it. With saline, obviously. And then some more dry gauze and some Q-tips. And some tape. So we're going to get started. To begin, obviously, I would ID the patient. I would check why we're irrigating, what we're irrigating, things like that. I would assess for any, obviously I'd put the bed at the lowest position. I would have the trash can in place. And then to begin here, we have the side rail down, obviously. She'd be positioned differently in the hospital bed, but to come the best, we're gonna work like this. So to begin, obviously we'd have our curtain and our door closed for privacy. I would assist her in a comfortable position, like I said. Gown, mask. I would check for any drains, tubes, or other adjuncts before beating the dressing. And then to get into our procedure here, to start, we're going to be peeling off this dressing. I have gloves on, obviously. Using the push-pull method, imagine this was glued down so it wouldn't come off as easy. You would push down the skin and peel, like so, along the edges, keeping the skin down and pulling off the dressing nicely. If it didn't come off easily, we could use some saline to kind of get it wet, loosen it up. But as you can see, I'm pushing and pulling and getting it off. Okay, now that we have it off, I would discard of this. And then what we'll do is I would first look at it. I'm going to note the depth, the color, the drainage, the odor, any eschar, any, let's see, what else? Depth, length. I'm going to assess basically everything about it, write down everything I can think about it. Then, to get started here, I would have her tilt a little bit so that I could run it down easily. And then to start, after I've measured everything, usually the Q-tips that they give you come with measuring sticks, so you go like this, kind of estimate depth, width, and then state those measurements. How I'm going to do this is I'm going to flow it down about 1 inch above, until it flows clear. Obviously with the lipstick on as a wound, it won't flow clear, but that's what we're going to be going for. So as you can see, I'm doing it like this, kind of up and down until it runs clear. Okay, it ran clear. Once it's been irrigated, I'm going to take some dry gauze and we're going to pad. Before I do that, after I've obviously irrigated, I would change gloves into sterile gloves when I set up my sterile field and did that. We're just using 1 pair of gloves though for the sake of the video, because after you irrigate and take the old dressing off, you'd want to change gloves before you put the new fresh stuff on that's sterile. So this one will be sterile. So I would pat or dry around the wound. Alright, now that's dry. I'm going to set up my wet gauze. So would obviously put that in there. That's what I'll be in the kit that it comes with. Once I have that in saline, take my wet gauze out. It's an accordion fold, or used to be how you would do it, like that. It's not too wet, just damp enough. There it goes. And then we're gonna take a Q-tip, and then the positioning with this. So this toilet paper again. Now let's get together. We're starting kind of like this. So you want to have a little bit out. And then we do this is we take the Q-tip and we would pack it. So it would kind of see how it's unfolding like an accordion. That's what we're going for. Obviously I can't pack her wound because it's not a real wound, but that's what we're going for. So once we're kind of packed here, it stays there. Now we're getting a new dressing. And then you could provide like a skin barrier or anything like that if there's any irritation. Lay it over like this. This tape that I have here. You tape it up four sides, much more gently than this obviously, but we're doing the best we can. Four sides, and then you would, I would take this, sign my initials and date it. So then this is a pen, All right, and that is a wind irrigation and a wet to dry dressing change. Thank you.